If you want to know what you need to do to treat postpartum depression, then this is the video for you. Make sure to subscribe so I can help you get your hormones in harmony and optimize your health. And don't forget to click the bell so you'll be the first to know when my new videos come out. Welcome back to the Hormone Healing Show. Postpartum depression is a really difficult thing. It happens to many women. Sometimes it's called the baby blues. Sometimes it can go into what's called a postpartum psychosis. And it can be incredibly damaging for the mother's psyche as well as her relationships, as well as the separation she may have from her baby. So it's really important to know what postpartum depression is and to get it treated as early as possible. Most of the time it is missed. So let me explain why you would even get the baby blues or postpartum depression. When you're pregnant, your estrogen levels are so high. That's just to get everything growing. Of course, your other hormones like progesterone and prolactin are really high, but it's estrogen that's really affecting your brain. Estrogens that's helping your brain create serotonin, which is that happy hormone that keeps you in balance and makes you feel wonderful and happy and joyful. But all of a sudden you give birth and your estrogen levels plummet. By day 9, your estrogen levels are so low that if you don't have enough support in terms of the rest of your hormones, in terms of your lifestyle, in terms of just your natural brain chemistry, then you are going to slip into a postpartum depression. Now, the way postpartum depression looks is you are incredibly overwhelmed by taking care of a new baby. You're getting anxious, you feel depressed, you're crying all the time. Everything frustrates you, and you usually have trouble getting to sleep, although you're exhausted. It's like a typical depression, but now you have a newborn to take care of. And especially if you're breastfeeding as well, which of course you should be doing if you can, it's going to make it even more complicated because that depressed energy and that anxiety that you're feeling is being transmitted to the baby, and the baby's getting more anxious and making you feel more anxious. So what are you going to do about it? So there's 3 things that you can do about it to help with your postpartum depression, to prevent it and to treat it. The first is you need help. It takes a village to raise a child, but more so, it takes a clan of women to help you with your newborn. It is not enough for you to just have your partner with you. You need more help than that, okay? In the past, in Aboriginal cultures and in our not too far past, all of us women had multiple women around us. We had midwives, we had doulas, we had our aunts, we had our sisters, we had our mothers, we had women from the village, women in the neighborhood, and they would help us with that newborn. They would cook, they would clean, they would help us with the breastfeeding issue, diapering issue, keep our spirits up, and most of all, take the baby from us so we could get some sleep. Now, if you don't get enough help, you are going to slip into some baby blues, no matter what. So organizing help before the baby is born is crucial to help preventing postpartum depression. And absolutely, if there are any signs of postpartum depression, then you want to get help as soon as possible. And I'm talking about get the women there. Now, you also need to get help in terms of contacting your healthcare provider. You need to get your lactation expert there. You need to get other help that's professional, but you really need your women with you that can help you through having a newborn, taking care of a newborn, and lifting your spirits. Now, number 2, you need sleep. Sleep is when you are, especially if you're sleeping in the dark, you're producing enough melatonin that will become serotonin during the day. Now, it's difficult to get enough sleep when you're breastfeeding a baby around the clock every 2 to 3 hours, a brand newborn. But you need to try to get as much sleep as possible so you make enough melatonin so that you can have enough serotonin so you don't slip into those baby blues. You need to have help in order for you to get that sleep. And when the baby is sleeping, you need to sleep. I don't care if it's in the middle of the day. I don't care if you have dishes to do and laundry to do. That's why you have the other women there to help you out. You need help, and you need that baby to go down and sleep, and you need to sleep when the baby's sleeping. So you get as much sleep as possible to prevent postpartum depression. Make enough melatonin to surge into serotonin to keep happy. And number 3, if you develop postpartum depression, and especially if you catch it early around day 9, you can be prescribed estrogen, particularly estradiol, and take extra B vitamins either by injection or sublingually. Orally works too, but sublingual injection gets in a lot faster. Estrogen transdermally or sublingually underneath the tongue. Both of these together, prescribed early enough postpartum, can prevent and treat postpartum depression. It is really critical that you get this early. Now, some women are a little concerned that if they take estrogen, it'll affect their breast milk production. It at low doses will not. I've been using estrogen and B vitamins for postpartum depression for 25 years, and it works every single time. You just need to get it on board, prescribed by your provider by day 9. That's why it's super important to know the early postpartum depression symptoms. Teary, anxious, unable to sleep, irritable, not bonding with the baby. Even sometimes trouble having your milk coming in can actually be some of those signs and can make you even more depressed. And one of the things that not all of you are new moms, not all of you are about to expect a baby or have daughters or granddaughters that are expecting babies, but know that if you suffer from postpartum depression when you're young, you're much more likely to have menopausal depression later. So please alert your healthcare providers so that they know that you need to get on treatment. You probably need bioidentical hormones if you can take them as soon as possible going into the perimenopause and menopause. So now that you know what you need to do to prevent and to treat postpartum depression, it's just not easy if the rest of your hormones are out of balance. That's why I created the Hormone Reboot Training, for you to discover how to get your hormones balanced naturally. It's free. Just click the link in the description below this video. So what's one hormone healing tip you might try this week? Leave your answer in the comments section below, and make sure you sign up for my Hormone Reboot Training. If this video was helpful, be sure to subscribe, share with your friends, and hit the like button so I know to make more videos like this. Thank you for watching my video, and I'll see you in the next one.